My name is Heather Law and I'm a physical therapist. Today I wanted to go over a couple different ways to release the pelvic floor. So I'm going to start with a couple general ways and we can get a little more specific. So first, easiest way, you could get a full foam roll, you can get a half foam roll, sit on it kind of like a saddle, and you can either just gently rock forward to get more of the anterior pelvic floor structures, gently rock back to get a little more of the posterior pelvic floor. Find wherever feels the tightest but tolerable. It shouldn't be painful. You shouldn't feel like you have to hold your breath. Try to find that spot and then work on just relaxation and some diaphragm breathing. So trying to breathe in through that belly, nice 360 breathing. And then exhale. See if you can stay there for that 2 to 5 minutes or until you feel like it starts to loosen up. If you don't have a foam roll, you can also use a ball, either kind of a smaller lacrosse ball, it's gonna be a little more tender, or a bigger, maybe more softball size, kind of a squishier ball. And same kind of thing, we find more of that tighter area where it's a little more anterior, posterior. Work on just relaxation, breathing, mental imagery, meditation, anything we can do just to kind of relax your system. So that's kind of nice if you get a lot of urgency in the car, you need something on the go, maybe at work, work on a little bit of gentle pelvic release. If we want to be more specific, this is called a pelvic wand. And so this is kind of similar to the Theracanes that you can use on your neck. This is how you can get an internal pelvic floor release. So if I get my pelvis here, so this is the front, the back. If we imagine the pelvic floor kind of as a little clock, we'll just kind of insert, usually just trying to start superficially, so just barely insert, put some water-based lubricant here on the pelvic wand, and then just add a little bit of gentle pressure. We can kind of work our way down the clock, and you can find where the muscles are the tightest. So we can try, maybe that 1 o'clock, 2 o'clock, and working our way down. You want to be careful, avoid the 12 o'clock position. That's where that urethra sits. Go all the way down. A lot of times people have tightness more in this 4, 5, 6, 7 o'clock down here range. So if you feel comfortable, you can go a little bit deeper, trying to get more of those posterior pelvic floor structures that attach along that tailbone. So same kind of idea where we're going to be doing this, working on gentle, light pressure, breathing, relaxation. So you can do this lying down in your bed in a nice supportive position, in a bath. You could also try this in the shower, and you can kind of prop one leg up and do some of the wand release there. Sometimes that's kind of nicer if you're pregnant and you're having a hard time reaching with the belly. If you have any questions, let me know. This should not be painful. It should just be a nice kind of gentle release. The tissue should kind of soften over time and should feel good and helpful. If it's painful, stop and let me know.